Today marks 12 weeks since my surgery, and I just cannot believe it. I posted earlier this week. We went to St. Louis on Monday for a Tuesday appointment, and my palatal splint came out, which was just the most relieving, emotional, amazing thing. I feel so much better with it out. I know it served its purpose, but it was time for it to go. And this is the first time in 17 years that I haven't had a splint in my mouth. So it's been quite an adjustment. I feel like I'm forgetting something all the time, that I've lost something. But it feels really, really good too. So I have been cleared to go back to work the week of the 22nd, so the week of Christmas. I am going to be working in the NICU for the first 5 weeks when I go back. For those of you that don't know, I am a resource pool nurse at a children's hospital in Indianapolis, which means I work on every unit. But with the restrictions that are in place for me for the first 4 to 5 weeks, it was just the safest thing for me to be pre assigned to one area. And thankfully, the NICU said they would take me. So I will be taking care of the littles for 5 weeks and we will be learning how to eat together. I am finding that I have no idea how to chew, so I haven't chewed in 2 years. And prior to that, I could only chew on the right because I had that tumor on the left, and so it caused the space to be so big that my teeth wouldn't touch. So I don't know that I've ever chewed correctly, and I'm finding that it's very challenging. So I've been working with my physical therapist and my myofunctional therapist to learn how to chew, and it's been very eye-opening and very fatiguing. So today I chewed 5 bites of chili and ate 2 crackers, and it did make me very sore, but I did learn a lot. So it's been very exciting and fun. It'll be slow going, but that's okay because, what's a few more weeks after 17 years? So, um, activity-wise, I have been cleared. So he doesn't want me, I can't take care of patients that weigh over 50 pounds for the first few weeks, just because of the lifting and turning. So I'm just kind of following that restriction as far as like lifting hay bales and bags of bedding and grain. But otherwise, I am allowed to bend over now. So I've started doing a few of my very basic inversions in yoga, like downward dog. Um, and my wheel pose, which has just been so nice to be back to doing some of my yoga routines. I've been able to increase my weights and increase the intensity of my cardio workouts too. So that's been relieving. I can't ride the horses yet. He wants me to wait until 4 months post op. So that's coming up, but it'll be here before we know it. Chewing, I've kind of already talked about. Therapies are kicking my butt, not the actual work of it, but just getting to all of them. So I'm doing physical therapy twice a week, myofunctional therapy once a week, and a med spa day, doing acupuncture adjustments and a foot detox soak once a week as well. And that doesn't include all of the exercises I'm doing every day. There's about, I think we're up to like 9 or 10. So I am staying very, very busy, but it is paying off. I'm just delighted. So, anyways, I think I covered the main things. Sleeping's getting a little bit better too. I'm allowed to sleep flat now. I have been since week 4. I've been allowed to, but I've been sleeping elevated just because my swelling and pain was worse when I was sleeping flat. Um, Dr. Mova had told me to go ahead and start sleeping flat, but I didn't want to make all these changes at one time, so I'm gonna do it gradually. And same thing with food. I'm trying to chew about 20 to 30% of my food, and then I'm just doing what I've been doing before, and just working my way up from there. So, anyways, you guys, this is amazing. Please reach out to me if you're in this process and you have any questions or would like some support. I've done a lot of crying this week. I've done a lot of crying over the past few years. But it'll be really good to be back in action at work, and I'm so excited to keep you updated. And I will post pictures of my incisions, and obviously, as you can tell, my swelling has gone way down too, which has been really nice. So, thank you guys. See you later.